Hello, I'm Dr. Wadsworth here at Uintah Spinal Health, and today I'm going to give you a sneak peek of what treatment may look like when you come into us with dealing with neck pain or neck discomfort. Everyone's treatment's going to be different. Everyone's treatment is going to be tailored to them, but so you may have all this, you may have some of this. But this is what it may look like. We'll start with some soft tissue work, manual therapy with some scraping with some instrument-assisted tools, cupping, manual stretching, and some dry needling with that work. So first I'll have Daniel lay on his back. On your back. On your back. So we have some lotion here. I'm going to show you a simple trigger point targeted stretching along the suboccipital, right in the lower part of the skull, the very bottom part of the skull, and this upper trap here. First evaluate and see what we have going on. What a trigger point is, there's some little nodules or little tiny knots within the muscle that are just hanging out and causing some pain. A lot of times rest doesn't get rid of them, so manual therapy needs to work them out. I have one right here. I'm going to pinch that little trigger point spot. I'm going to stretch the muscle out. Do this a couple times. Do a similar thing to up here at the bottom of the skull. Find one here. We'll just stretch here. So that's kind of the manual therapy of some manual stretching with trigger point targeted work. There's also, like I said, cupping. I have him use this cup and cup over that muscle that is going to increase some blood flow to the area and get some tension to release in the fascia and the muscle there. And scraping, people have heard of scraping or grafting. You have these metal tools and you'll scrape, have a similar result with a different technique. We may also do some dry needling, a dry needling technique if we think it's clinically going to be helpful for you. What that is going to be a little tiny needle. I'll show you a little technique we use for the upper trap. We'll use it in this area to help address the trigger points in that area that we may find. What I'm going to do is I'm going to grab the upper trap, pull it away from his body, not get his shirt, just kind of feel a little prick right there. So I find this trigger point. What I'll do is do this little technique to address the muscle itself directly. That's one thing that we like about the dry needles, that it gets through the skin, actually addresses the muscle. It will help increase some blood flow and get a pro-inflammatory response. And with this technique, we'll really try to address that trigger point